And there's a pharmaceutical drug out there called Zulrosso, which is about $100,000 a year. $34,000 for the medication. Then you have to go to the hospital for 30 hours a month to get it IV infused. You might have seen it for treating postpartum depression. But the added benefits are antidepressant, anti-anxiety, improved sleep. Because pregnenolone, progesterone, allopregnenolone, what do? They're synaptogenic, free radical scavenging, neuroregenerative on one side, and on the other side, it increases GABA production. And you asked a question about marijuana. Well, it turns out that why people develop resistance to marijuana, they need more and more and more, is because CPD, or the CB1 receptor, which marijuana goes to, turns on. When you turn it on, you increase pregnenolone production. And what does pregnenolone do? It blocks the CP1 receptors, so that you need more marijuana, more delta 9 THC and CBD to get the beneficial effects. So, in fact, the literature has articles where pregnenolone not only helps you to detox from benzodiazepines, the Valiums, and so forth, but it also blocks the effect of marijuana. So, if you have people who are on marijuana and they want to get off of it, pregnenolone works. I had a guy that for 35 years smoked a joint for breakfast, a joint for lunch, and a joint for dinner for 35 years. 6 months on one of our programs, he calls up and says, "Doc, I woke up this morning. I had no craving for marijuana." I said, "Is that good or bad?" Because I wasn't going after that. And that's what led me to start researching how it works. So pregnenolone, phenomenal. I don't use progesterone. We did a study on 5 to 10 milligrams at nighttime of progesterone, oral capsule or liquid, sublingual, to help them with sleep if they were insomniac. But it turned out that cheaper and less, problems with, oh, I'm taking progesterone. They would take it $80 versus $1,000 a year. And the science there to show that it gets absorbed and gets into the brain 4 or 5 times more in the brain than the circulation.
So 2 points though. If you're listening to this and you're a woman on hormone replacement therapy and you're on estrogen and you have a uterus, you have to take progesterone. So don't stop your progesterone because you don't think it's helping you sleep. So just caveat. Number 2 though, pregnenolone. So what dose of pregnenolone? Is this like 100 at bedtime? How much are you giving people?